We're going to continue another interview now, this time with Mr. Howard Foreman. He is a professor of management, public health, and radiology at Yale University. Good morning.
Hi, how are you?
Very good. Thank you for joining us. So we just heard from a regular contributor who had traveled to the U.S. a couple of weeks back, and he was saying that the situation has changed quite a bit, not 180%, but people are definitely becoming more concerned in the U.S. What is your perception of the situation, especially from a public health expert's perspective?
Yeah, I think that the healthcare community is becoming very concerned and hyper alert. I think over the last couple of weeks, both the public health and healthcare communities have started to come together both to sort of agitate for the things that are needed at this time as well as to prepare for what we know is coming.
Mm-hmm. I remember seeing on several interviews from weeks back, I believe, that public care authorities and experts in the U.S. had been calling for more broad testing, and that was not taking place, especially in the beginning. What are your thoughts on that, and how important is broad-scale testing?
Yeah, so I think there's several issues there. One is that we are still woefully inadequate in terms of our testing capacity. Our overall capacity right now is still probably about 1/10 to 1/12 the level that Korea has been able to test at. And so that's inadequate. I think that your country, South Korea, has been able to consistently be testing at a very high rate, and that's very, very helpful. It can provide valuable information about where the outbreaks are. It helps us track people down and prevent continued spread. At this point, nobody believes this can be contained, but it can be substantially mitigated. And mitigation means that we would at least avoid overwhelming our system as we're seeing right now in northern Italy.
Mm-hmm. You said that the U.S. Testing capability is about 1/10 of what we're seeing here in Korea. I believe Korea has been testing around 10,000 per day. So you're saying that the U.S. average is about 1,000 per day?
Well, I'm talking on a per capita basis. So
per capita basis, I see.
I think we're about 5 or 6 times the size of you, and we're probably testing around 5,000 or 6,000 people a day right now.
And is that adequate?
It's nowhere near adequate. We need to get that number up, closer to the 100,000 range for us to really be adequate. And that would still only be adequate for the current demand. That number would be expected to increase over the ensuing days and weeks after that. And it would not be unreasonable to want to be able to test, 1 million people a week or more. And some would even say 1 million people a day or more in order to really get control of this.
What, in your opinion, is holding testing back in the U.S.? Obviously, the U.S. has a very advanced medical industry and system. Is it just the cost of getting tested or people who don't have private health insurance?
No, I wish it were that because I think that would be an easier explanation for all of this. I think it's a combination and a multitude of errors that occurred along the way. One is the CDC developing their own lab tests rather than using the WHO lab tests apparently resulted in the multi-week delay in having our own capability. Second was the Centers for Disease Control not allowing private laboratories and others to begin doing their own test preparation, and so that slowed things down as well. And then I think right now it's just the time it takes to stand up a laboratory and do so, properly. It's not something that you can just turn on in one day. So I think that what we're seeing now as the capacity is starting to come online pretty much, I would say last Friday was the first day of in-state testing for 4 different states. So that gives you a sense of just how far behind we were. But now we're sort of ramping up capacity. I'm hoping that sometime by early next week we will have what I consider to be sort of a minimal adequate capacity, but that's still many, many weeks later than we should have had.
Right. So I guess from next week, we'll see the numbers in the U.S. of confirmed cases start to surge as well. But you mentioned in previous interviews and articles about public fear. And Korea, as you mentioned, has been at the forefront of testing very quickly and also on a massive scale. But I guess one, if you can call it a downside, is that it has been invoking sort of fear in other countries, which has led to 116 countries sort of putting restrictions on travelers from Korea as well. So, what is your opinion about having this open testing and these transparency in the numbers that are confirmed, but also then in promoting sort of fear in the market? Where's the balance?
Yeah, look, I think that what we're facing right now is a true pandemic that is of a proportion that we have not faced in modern history. And I think when you have something of that scale, to have a sense of fear is not inappropriate. I mean, we are, biologically programmed to have fear as a protective instinct. And so the fact that we may experience fear right now may not be inappropriate. Your experience right now, which includes, one very, very large center of activity in your city of, I believe, Daegu. I don't know how to
Daegu.
pronounce it. Daegu, is one massive outbreak that I think you have done phenomenally well at mitigating and trying to contain it. But even in Korea right now, there are still spot outbreaks in a lot of other cities, including Seoul now, that is growing at a rate that it wasn't a few days ago. So I don't want to say that even for the people of South Korea that they are out of the woods or that they can, look and say this wasn't a big deal. From an outsider's viewpoint, I would say that Korea should be looked at with a lot of pride, and you should have a lot of pride in what you've been able to do. But I do think that when you're facing something as enormous as this, having fear is just not inappropriate.
Mm-hmm. What is your personal opinion of the measures that have been taken in Italy, a national lockdown and the closing of all businesses, basically, except for pharmacies and essential businesses? Do you think that is an appropriate response?
Really hard to say. I think, but certainly in northern Italy, it's out of control there, and anything they can do to mitigate spread is important because their health system is completely overwhelmed, and because of that, people are literally dying because of this, not even from it. They are dying from it and because of it. There are people that are probably having heart attacks and strokes who otherwise could live, but because the health system is overwhelmed by COVID cases, coronavirus cases, they are going to die, and that is what we have to avoid in every part of the country, in the world. Mm-hmm. I don't know enough to say whether locking down Rome and locking down, other parts of Italy was absolutely necessary at this point, but I do sense their despair, and I think, again, as we've discussed, the numbers coming out of Italy today are a reflection of an epidemic that was hitting them a week ago or 10 days ago. So, if someone dies today, it's not because they got infected today. It's likely that they got infected 10, 12, 15 days ago.
I want to thank you very much, Professor Howard Foreman. Unfortunately, we're out of time. Thank you very much for your time.
No problem.
That was Howard Foreman.
Good evening.
You too.
Take care.
Professor of Management, Public Health, and Radiology at Yale University. That's going to close today's edition of TBS EFM's COVID-19 live updates in English. The Chinese version is coming up next after your hourly bulletin.